Fibroid disease is the growth of non-cancerous tumors from the smooth muscle cells of the myometrium of the uterus, and they're the most common gynecologic tumors in our patients. Major signs and symptoms of fibroid disease could be divided into more like bleeding patterns as well as what we call bulk symptoms. So bleeding patterns could be usually abnormal bleeding, where you're bleeding in between your periods, or heavy bleeding during your period as well, requiring sometimes, like I said, becoming so anemic that they need blood transfusions or IV iron transfusions. And then the bulk symptoms could be more like constipation from having a big fibroid uterus pressing on the bladder. Sometimes patients also have urinary frequency. You might also have pelvic pain and pressure. Those are a little bit more due to the fibroid size and volume. Options for management could be, again, grouped into kind of medical management as well as surgical intervention. So medical management oftentimes is to address more of the bleeding symptoms. So patients with heavy periods, we start with hormonal intervention with oral contraceptive pills, progestin pills. Oftentimes hormonal IUDs are also options for that, and that helps to decrease the bleeding. But nothing will actually make it go away other than surgery. So surgical approach could be often done in terms of abdominal approach, whether that's minimally invasive with robotic incisions or open approach depending on the size. Sometimes if the fibroid is actually what we call submucosal myoma, which is actually the lining of the uterus, they could actually be resected hysteroscopically, which is a vaginal approach. Another more of a surgical procedural intervention is what we call uterine artery embolization, which basically decreases the blood flow to the fibroids, and that helps to shrink the volume of the fibroids. I think it's really important to talk about your symptoms and about your bleeding patterns to your gynecologist on your annual exams, and not just think it's a normal, because addressing the fibroids when they're smaller is always easier versus when they're like 10 to 15 centimeters in size. So I think before brushing it off as like my constipation is normal or my bleeding pattern is normal, talk to your gynecologist to kind of tease out, and by doing an exam and having ultrasound and imaging, we could diagnose fibroids earlier and hopefully address it earlier than later.